This is a video on AI for surgeons, and this is coming through my YouTube channel AI Nexus. I'm Dr. TV Geeta, and I'm a AI expert. Please do subscribe to my channel. This particular video is going to talk about effective use of ChatGPT and how good prompting would lead to better surgical practice. So, what is ChatGPT is the first question. I'm sure all of you know, but still, for completeness sake, let me say ChatGPT is an AI chatbot. It interacts with you in a very conversational manner. The most important thing it can remember the question it asked last and then answer you in an intelligent manner. So, why should surgeons care about GPT? It gives them quick clinical knowledge, research support it gives them, documentation, especially draft operation notes, discharge summaries, and so on. For teaching and training, creating quizzes, case discussions, and so on. Patient communication converts complex medical terms to easy understandable language. Clinical decision support assists in differential diagnosis and guideline based recommendation and so on. And in doing all this, it improves productivity. It saves time on repetitive writing and information retrieval tasks and allows the surgeon to concentrate on better patient care. So, how to use? You have to install ChatGPT on your phone. If it's iPhone, you have to open the App Store, search for ChatGPT, tap Get, install it, and sign in. If it's Android, open Google Play Store, search for ChatGPT, tap Install, open the app, and sign in. After you open, you will see a text box. There you have to type a question or request. In ChatGPT terms, it's called prompt. And then you enter. Please press the enter and you will get the answer. After that, you can continue with the conversation. So, for example, explain the steps of liver transplantation. It will give you the answer. But remember, and more importantly, don't expect ChatGPT to give you the answer in the first go. So you can ask follow-up questions. For example, can you explain that more explicitly or simply, or can you explain this part better and so on. Now, some important things that you can do is you can upload images or files. And for example, if you ask about a microscope image of uploaded, describe what you observe in this blood smear. You can upload a file and ask ChatGPT to summarize or explain, edit, or analyze it. You can also describe an image and then ask ChatGPT to generate the image. This is very important and very useful prompt for ChatGPT. So create an illustration of the steps of wound healing. If you ask, it will create an image. But please note, all this has to be verified by you. So, where all can ChatGPT be effectively used in the surgical workflow? In pre-operative phase, it can be used to generate differential diagnosis, summarize patient records, create checklists, and so on. Intraoperative, it can review the procedural steps, create equipment and instrument checklists, anticipate complication and mitigation strategies. Post-operative, it can generate discharge summaries, create patient education materials, summarize post-operative guidelines, and suggest monitoring parameters. Education and research, very important, literature reviews, exam preparation, case discussion, everything. But the golden rule is ChatGPT assists clinical thinking. It does not replace the surgeon's judgment. Now we're going to look at some important ways of prompting. So for this, we are designing a surgeon prompting framework where the elements are situation, user rule, relevant information, goal, expected output, constraints, and next steps. So here, of course, it means define the clinical scenario, patient demographics and all that. Example is given here, 65-year-old male with acute right lower quadrant pain for 12 hours. Specify the role. This is very important. So whether it's a general surgeon, what is the level of expertise? So act as an experienced general surgeon, for example. Provide essential clinical data, including history, examination, vitals, labs, images, patient negative. What you give here is very important, and that is up to you as a surgeon. That is given here. And then this is important, state the specific task or objective. So here we are looking at differential diagnosis. That's what we want. So provide a prioritized differential diagnosis. Now you can say in what format you want. As a table, we have given it as a table. List diagnosis with key clues and likelihood in a table. Then you can ask the output, set boundaries, evidence base, use guidelines, and so on. Use current evidence and guidelines, state assumptions and limitations. This is very, very important because it may make something which is which is has limitations. So it will tell you that also. Request actionable recommendation, further investigation, immediate management, and red flags. So recommend further tests, immediate management, and so on. So the output that it can give for this example is it has given you 5 differential diagnoses along with the percentage. So the acute appendicitis is what is 70%. And why it decided on that, what are the key clues it's used is also given. You know better than me about these things. Next, we go for generating a treatment plan. So the input is 62-year-old male with mild rectal cancer, MRI T3N1, and the role is called colorectal surgeon. You are asking it to provide surgical management plan, and you want to achieve curative resection with negative margins, and you are given evidence as MRI pelvis and staging CT chest negative. You have to upload this as images to the ChatGPT, and you want as output a step-by-step treatment plan table. Okay, and you have to follow, these are the constraints, you want it to follow NCCN guidelines. Okay, and you're also saying consider this preservation. So the action is in very concise form. So multidisciplinary discussion, neoadjuvant chemoradiotherapy recommended, restaging MRI after therapy, total mesorectal excision planned, consider low anterior resection if feasible, evaluate need for temporary stoma, post-op pathology, review for margins. Now the output, as a surgeon you may not agree with it, that's fine. You can modify the prompts so that you get what you want. Okay, and even in spite of all that, you may not get exactly what you want, but it helped you at least 80% it is correct. So please don't believe that it is completely correct. Okay, so next we are looking at an emergency surgery situation. You're given a situation, 28-year-old male, decide management and what you want to, the goal is to prevent, and evidence, management algorithm, and what guidelines you have to. So confirm diagnosis of acute appendicitis, start, so the CT is given, start IV antibiotics, and assess for laparoscopic appendectomy, proceed to surgery if indicated, post-op recovery plan. Findings are consistent with acute appendicitis. Early surgery is recommended to prevent perforation and sepsis, which you have asked was the goal. So this is a clear prompt. You got a good AI response, and you can have a better clinical outcome. Next is anticipated complication and mitigation strategies. So given the situation, 45-year-old female, act as experienced general surgeon specializing in hepatobiliary surgery. History is given. This is very important. What you give as history is important. Goal, identify anticipated complication for laparoscopic colostomy and propose mitigation strategies, stable with complication. That's how you want the output. And output constraints, it should be evidence-based. It should include preventive and intraoperative strategies and mention key red flags. And next step, suggest intraoperative checklist and post-operative monitoring priorities. So anticipated complication is given here. The percentage likelihood is given here, and the impact is given. Okay, so high impact is high, critical view of safety mitigation strategies all are given, moderate and so on. So this is what you have asked it. So it is given an output like this. Next, image interpretation. This is very interesting. So bowel obstruction suspected, that's the situation. You are a surgical resident. You want to interpret the CT scan, identify cause and urgency, that is the goal. And evidence is obviously the CT, you have to give it the correct one. And then output, differential diagnosis table, and highlight surgical emergencies. So here we have findings: transition point, dilated proximal colon, wall thickening, air fluid levels. So mechanical obstruction, obstruction confirmed, suspicious for malignancy, acute obstruction severity. So the conclusion is given here: an urgent surgical evaluation is recommended. Next is surgical case discussion. Here you have the scenario. You are a senior consultant surgeon leading a multidisciplinary case discussion. Objective is to analyze the case, prioritize diagnosis, recommend investigation, formulate management, and so on. So the relevant information is given for the case discussion, and you are expected to generate 7 things, which is given here, and we will go to that. An evidence-based recommendation on current international surgical guidelines and accepted best practices. This is important. Output format, use headings, tables, and so on. Next steps, what do you do? So a output example, we have just looked at the 7 key sessions: a case summary, rank differential diagnosis, additional investigation recommended, immediate management, operative versus conservative management, anticipated complications, and key learning points. So this is a case discussion. Teaching, suppose you want. So you are a senior professor of surgery teaching third-year residents in laparoscopic thing. So understanding the objective, create a complete teaching module to understand, perform safely, and prevent complications. Relevant information. So duration, what is the duration of the teaching, and what is the level of the students. See how the prompting is different, and what all you want. You want a teaching summary, you want the anatomy, you want the steps, you want the pearls and pitfalls, you want the complications, you want post-op. You can give anything you want. An output format, use headings, tables, checklist, and so on, and the next steps. Okay, so we get all that it is asked for in a format that you have requested.